generous of you. I'm going to go back to the gentleman in the car. I called you our favorite pharmacist, the gentleman from Georgia, Mr. Carter, for your 5 minutes of questions.
Thank you, Madam Chair. I appreciate this, and thank you for bearing with me. Dr. Collins, Dr. Brooks, thank both of you for being here. This is extremely important. I've got a staffer who has been diagnosed with long COVID, and that individual has suffered from severe anxiety, fatigue, long-lasting loss of smell and taste, and these are very serious issues, and I'm very concerned obviously because it's someone close to me. I wanted to ask you, the staffer in my office, she says that many of her long COVID symptoms dissipated after she received the vaccine. Is the CDC or the NIH aware of any reason the vaccine may help with long COVID symptoms? Dr. Brooks?
That's a great question. Thank you. And I'll say these were fascinating reports when they began to come out. We've talked a little bit about this, so I don't want to go over all of that territory other than to say there are some emerging research data that suggest there may be something there, but we've really got to look at it more closely. The mechanisms there are multiple things that could be going on. I think the ones that I like the most are the idea that the vaccine is bringing benefit in terms of either controlling this if it's an ongoing active infection that we're not recognizing, or doing something to get the immune system back on track to where it should have been. Also, this is a great reason for people who are having post-COVID to get vaccinated if they haven't been vaccinated already. We can't guarantee that this positive experience that some people have reported is one that everyone will have, but I certainly hope it would bring people off the sidelines to get vaccinated if they're hesitant.
That's great. Dr. Collins, are you aware of any studies that are being done about this?
Yeah, there is one small study that's been published as a peer review, but it's 44 individuals where there was overall a small improvement in those who got vaccinated versus those who didn't. But also there is a patient support group called Survivor Corps, and they did a survey, I think more than 500 individuals who had long COVID, got vaccinated. 40% of them reported some improvement, which was encouraging to hear. And relatively few reported the opposite of having a worsening of their symptoms. What exactly that means as far as the mechanism, I'm sure you're wondering about that too, because we all are. Does that mean that those individuals with long COVID still have a low-level viral infection that we haven't been able to quite discover, and that the vaccine basically gives their immune system the kick it needs in order to take care of that residual virus? Or is it that they have an autoimmune condition already because of that COVID infection and the vaccine interrupts with that? We don't know. Those are theories.
Good. I'm going to kind of go off script here because this is something that, and I never try to get personal in any of my, any of these hearings, but I've got a dear friend who is suffering right now with psychological mental problems as a result of COVID. What's going on with that, Dr. Collins? Did you know? I mean, he's had to be admitted, and I'm just worried to death about it.
I'm very worried about that because we are seeing instances. First of all, let me say anxiety and depression is a very common feature of long COVID, but there are instances of actual induction of new psychoses, individuals who previously were normally functioning who actually fall really into a much more serious psychiatric illness. We assume there must be some way in which this virus has interfered with the function of the brain, maybe by affecting vascular systems or some other means of altering the way in which the brain normally works. But we have so little information right now about what that actual anatomic mechanism might be, and that's something we have to study intensively. But you're so right. This is a big part of long COVID, is the mental health consequences. We shouldn't just talk about shortness of breath and palpitations. We got to talk about the mental health issues.
Dr. Brooks, any comment on that?
I completely agree that mental health is often the last breath in a discussion of what we need to address, when often in a condition like this, it needs to be the first thing we bring to the front. I hope your friend gets the care they need, and I'm very, very sorry to hear how ill they are.
I tell you, it is just, obviously, I mean, I'm very, very concerned, and it has a vaccine. I don't, to be quite honest with you, I don't know whether he's gotten the vaccine or not. Is this another instant? If he were to get the vaccine, has it shown improvement for these people?
I think from what Dr. Collins described, there's a possibility it will help, and there's not a lot of indication that it's going to do harm. And we know that in the long run, it will protect him against the possibility of reinfection. I'd do it.
Yeah, I'm with you.
Good. Okay, Madam Chair, thank you very much. I appreciate it. And I'll yield back.
The